Hi, everybody. Welcome to MD Consultants live Q&A, interview prep Q&A. So my name is Manveen Puri. I'm one of the founding partners at MD Consultants. I'll start by just giving you a bit of background about myself, what I do, and we'll go through a series of pre-prepared questions that have been voiced by many of you in the lead up to this interview. If you do have questions along the way during this interview, please send us a text. This is my first time sort of going live with Facebook, but if we do have our business development manager who is on hand to give me any technical assistance should I need that. So without further stoppages, let's start. We'll go for about 30 minutes, and I'll try and answer as many questions as I can in that time period. So just a bit of background. So I am a family doctor. I also do a bit of rural emergency medicine. I work full-time with the Canadian Forces. So my family practice consists mostly of military medicine, but I also do some addictions and emergency medicine work on the side. I went to undergrad at the University of Toronto, graduated in 2009, and then went to medical school at the University of Toronto, finished that in 2013, completed a residency in family medicine in 2015, and have been in practice for about a year and a half now. In terms of my experience with the admissions process, I have been on numerous interview committees, both during my undergrad and in residency, and I have also had extensive experience assisting pre-med and pre-med students and medical students through the application process for both medical school and for residency applications. So let's get to our first question that I see on this list. The top one that I see up here is, how can we prepare for the MMI? So this session will focus predominantly on the MMI. We'll take a couple of questions on traditional panel interviews as well as we go along. So question one, how can we prepare for the MMI without paid services? So this was asked by, let me see if I have a name. I don't really have a name for that question. Okay. My advice in terms of prep for the MMI would be to treat it just like any other interview. The MMI is just one format that is very structured compared to other formats. But you have to remember that you, over the course of an MMI circuit, want to convey the same information that you would in a traditional interview. So like any interview, my approach, the advice that I usually give is to start with a lot of introspection, start with a lot of questions about yourself. So make sure you understand, do a lot of background, personal questions, understand why you're applying to medicine, why you're a good candidate, where you see yourself in a couple of years, understand your experiences that led you to that point. Make sure you have done your research into various situational questions. If there are skills that you really want to demonstrate over that course of 90 minutes or so, make sure you have nice examples, because sometimes traditional interview questions do get thrown into the MMI as well. You may have one or two stations that are traditional, more traditional type questions. So make sure you have examples, well elaborated examples to bring out anything from leadership skills to communication skills. Step 3 in terms of MMI prep is, so step 1 again, personal research. Step 2, behavioral questions, so situations and behavior. Step 3, current affairs. So make sure you have a really good sense of what's going on in the world of medicine today. Make sure you understand all the issues that are in the news. Make sure you have a good sense of current health policy discussions, because various formats of these can creep into MMI questions. And the additional thing is that some of the MMI questions are vague enough that they really give you the opportunity to demonstrate your knowledge of a lot of the going-ons in medicine. So if you are not able to take advantage of those opportunities, that essentially is a big wasted opportunity. And question 4, step step 4 would be to do ethical questions. So make sure you read, make sure you have a good ethics book that you get through, because you will be presented with ethical dilemmas that may not appear as obvious ethical dilemmas, but the way you structure your answers have to sort of be an ethical dilemma. So those are the 4 domains in which I typically tend to start with preparation for a regular interview. So make sure you at least touch on all 4, and then tailor your research to the MMI format. In terms of the timing and in terms of the various practice stations that are out there. All right, well, that was question 1. Hopefully that was helpful. Let's go on to our next question. So there's a question that we got from one of our panelists that says, what are sample questions for the MMI, and how do we approach them? So that's a pretty broad question. I don't think it sort of goes a bit beyond the scope of this format to go into specific MMI questions. What I'll do is try and sort of cover some of the broad categories of questions that you will see. There's lots of questions that you can get online completely for free. There are many free resources out there, either through basic online searches, through various university career centers, or through various test prep companies that will give you exposure to lots of different stations that are out there. In terms of sort of the main formats that you tend to see, so you tend to see questions that test primarily communication skills, questions that test critical thinking skills, questions that test ethical decision making skills. Those are the big scenarios really that you sort of will tend to encounter over the course of an MMI. Again, like I said, you have to remember that you have to take the station despite the format and convey a couple of key traits about yourself despite that format. If you just were to do a good online search, you will have many examples to the various types of stations that make up the MMI. All right, let's go to our next question. So there's a question that we got, what was the most challenging question you encountered at your interviews, and how did you handle it? So that's a great question. So I mean, I think the most challenging questions that I found were questions not necessarily inherent to the questions itself. I was fairly well prepared when I had my interviews back now almost 7 years ago. I found the most challenging sort of situations to be ones where the interviewers would actually press you and confront you with different scenarios. Often these would happen in ethical type stations, where they could sort of twist scenarios in different ways and put you on the spot to see how you would think on the spot. Or this could even happen in a situational type question. If if someone asks you to describe a time when you sort of demonstrated leadership skills, and you give them your sort of standard prepared answer, and they sort of say, well, look, I don't think that was a good example. Maybe you should have done this instead. So sometimes scenarios are sort of sometimes the interviewer's responses are intended to challenge you and sort of think, get a sense of how you react on the spot, and see if you get flustered or you're able to stay calm, because that is an important trait that they try and discern over the course of an interview. Can this person withstand the rigors of medical education, and that is one of the proxies by which they make that decision. So the most challenging situations I found were ones where the interviewers would take an almost adversarial role and challenge your responses, because that certainly can add to the stress of the day. So next question. in cases where you do blank out and aren't able to come up with a comprehensive answer, what did you do? So again, I repeat the question. In cases when you blank out and aren't able to come up with a comprehensive answer, what did you do? So that's interesting. So I mean, I think my approach to that has been to sort of just go back to the basics, right? Sort of in your head, typically, you know, you're able to break down the different questions into, if you've done your research, you're able to break down the different questions into, you know, the big categories, you know, like I said, sort of, you know, personal background related questions, you know, behavioral skills types questions, ethical questions, current affairs type questions, and sort of see why is the, like if you ask yourself, why is the interviewer actually asking me this question? What is the interviewer trying to gain out of asking me that question? That sort of that really sort of helps to, you know, really helps to help guide your answer. So I don't think I sort of directly in my own interviews for med school or residency encountered situations where I completely blanked out. I certainly have in other, you know, types of interviews, job interviews and stuff like that. Typically, you know, you're doing a lot of politician talk to some extent, where you're you know, going back to the basics, reiterating your answers in terms of fundamentals, in terms of why you're a good candidate and how your skills meet the situation. Again, this sort of depends on the question, right? So if this is an ethical question and you're blanking out, you can obviously sort of, you know, it's completely fair to sort of say you need a couple of moments to sort of think through your answer. So that is something you can ask for. It's much better to take a moment, take a pause, have a glass of water, than to sort of go out and give an answer that just makes no sense, and then you're left in a hole because you've made a couple of statements that you can't really back up. So my approach to this is go back to the basics. If it starts to become a complicated ethical scenario, ask the interviewer to, you know, clarify the question if you're unclear about what exactly the question is referring to. The other way you can sort of do that, if this is an ethical question that you're blanking out on, is to answer with a couple of assumptions, right? So if you're having a question that you know, you think you have an answer but you're not sure it's a great answer, you know, you can say your answer but sort of say the conditions under which this answer is valid, right? You're assuming a couple of things. And say if those assumptions change, then your answer will change. So that's how I would go through that question. Next question. So I'm not seeing. Let me just take a quick pause to sort of see if I see any live questions that I'm getting. I don't think there've been any live questions right now. So one way you can actually ask me live questions is to just comment on this video. I'm just gonna sort of type right now, right here. So I've just sort of typed that, you know, you can ask me any questions right here. So that's an easy mechanism for me to answer any of your questions in real time. So why don't you try that if you want me to elaborate on any of the questions that I have. So let's go to our next question, which is what strategies did you use to tackle ethical dilemma questions? The main strategy with ethical dilemma questions, at least at sort of the pre-med level, is really a lot of preparation. I think a lot of us, you know, I certainly didn't have a lot of exposure to ethical dilemma questions prior to entering medical school. The one thing you have to remember is that the whole purpose of, you know, things like medical school is to teach you some of the right responses to some of those situations. Having said that, the more prepared you are for ethical dilemma type questions, the better you're going to look, the less flustered you're going to become if you get challenged on the spot. So the strategies I used really involved sort of researching the various types of questions that commonly come up in interviews like these, grouping them into categories, and then practicing, doing lots of practice. So, reading first, and then doing lots of practice. So, in terms of resources that, I read, really nothing remarkable. There's a book called Doing Right by Philip Herbert that is widely used by many med students, pre-med students for interview preparation. It lists, a couple of the principles that come up when tackling ethical dilemma type questions. So that was one of the resources I used, and then I did practice. Ethical questions were ones that I specifically practiced because I knew those could be quite challenging, and I think those did end up in real life being amongst the more challenging questions that I faced on the real interviews that I went for as well. So a couple of other things that I would suggest are useful for ethical dilemma type questions are to, like I said just now, clarify the question, right? Avoid, really with ethical dilemma type questions, what you want to try and do is not make any huge red flag mistakes, right? Not make any statements that automatically jump out to the trained ear as, this person has a couple of, opinions that are way off center. So a lot of that involved, getting a sense of what exactly are the opinions that typically are within the mainstream, within the medical community that are considered, discourse that can take place within an interview. So once you understand what exists within what your left and right arcs are for an interview, you'll get a sense of what the red flags are and what are statements that you really shouldn't have. You shouldn't really discuss within the course of an interview. So avoid the red flags, right? That's a big no. In fact, avoid the yellow flags as well. Having said that, you can't really sort of answer an ethical dilemma question without committing to an answer, right? So what the interviewers really want to see is that you do have the guts to sort of make a decision and defend your decision. Really, that's what they're looking for. So you do have to sort of pick what you will do. Some of these questions are not questions that you could be wishy-washy on. You do have to sort of pick a side and be able to defend, your decision. So really what you have to do is be able to state why you made that decision, under what circumstances you made that decision, and that usually has to do with given all the factors that you sort of see, you can think aloud in an interview and sort of state all those sort of different things that are coming to bear in your decision, and then answer your question. So I see a question right now from Amal that says, what are yellow and red flags? So that's a great question. I don't think I actually elaborated on that specifically. So red flags essentially are big no's, right? So, an example of a red flag in an interview would be if you sort of, make a statement that, if you go into a controversial topic so something like, abortion, if you were to sort of say that, like doctors essentially should not be performing abortions, right? That essentially starts to wade into the category of opinion, and to many people on the other side can be perceived as, this is a really strong sort of opinionated person. So that can be a red flag, right? Again, a lot of this is often ends up being yellow flags, because if you can make opinions, and as long as you can defend them in a way that sort of you don't come across as confrontational, that's considered completely okay. Yellow flags don't quite raise the level of alarm that red flags do, but they still can pique the ears of interviewers on the other side, and cause them to pay more attention, which can lead you going down a rabbit hole. So hopefully that answers that question, Amal. So let's go to our next question. So one of the questions that I see up here is that what are some of the questions I should ask my interviewer to determine if the school is a good fit for me? So that's pretty straightforward. I mean, I think you should ask questions that make sense for you. These should be legitimate points that you want to know, that you don't have an answer to about the school. I think if you've put in your research going into the interview, there would be plenty of questions. A lot of these, I think the best questions to ask are questions that have to do with perspective, as opposed to strictly fact-based questions about programs and curriculum, because really what you can sort of do for questions like that is there's websites, there's university policy, there's usually administrative people who can give you much better answers than the clinicians or residents or medical students that are sitting on those panels. So often the questions I find work best are questions that ask the person in front of you to give you their perspective on what their experience has been like, and you take that with a grain of salt. But a lot of this, what that does is that tends to build some rapport with the person on the other side, and you have to remember that at the end of the day, the interviewer has to at some level like you, right? They have to think that you're someone that they can work with, that would make a good physician. There might be sort of very technical questions that you want to sort of really know the answer to, though, like the interview, that narrow window that you get for a conversation at the end of an interview really may not be the best time to ask those questions. And keep in mind, you probably don't have a window with the MMI to actually ask questions like that. So next question. All right. So just to follow up, I guess, to the one we had just now, with the questions I asked my interviewer affect my chances of admissions? For example, if I ask about financial aid. So the one way to think about this is that anything you say in that interaction will affect your chances of admission, right? You're on the spot, and I think when most interviewers assess you, the MMI tries to be as objective as possible, but really at the end of the day, you have to remember the interviewers are just people, and there's a big sense, there are many studies that actually demonstrate this, there's a big sense of, overall, does the person think that, you're competent, you know what you're doing, and that sort of comes to bear with how they make their decisions on, how highly they'll score candidates. So if you're asking questions that, are inappropriate for the format, that would probably not be the best time to ask those questions. Having said that, question about financial aid, I'm not sure that is even necessarily a spot to ask it. I think questions about financial aid, there are many people besides the interviewers who can answer that question better than the people there who probably won't be able to speak to specific numbers and only be able to answer in terms of broad policy. So I don't think a question on financial aid would harm your chances, but I don't think it's going to help your chances either. So next question. Should I structure my answers differently when I talk to a medical student versus a faculty or a community member? So again, this is more of a panel interview type question. I don't think so. I don't think you should structure the questions any differently. I think if a specific person is asking you that question, you have to make sure you recognize sort of their background and where that question is coming from, right? The questions, if you're having a group of a medical student, faculty member, and a community member, they will sort of sometimes give you questions that come from that specific background type. Addressing those specific things is important. But having said that, they're all evaluating you together. So I don't think you should necessarily be talking any differently. So we just got a question live. It's a question from Rishi. In an MMI situation where you need to provide criticism for a fellow interviewee, how would you suggest going about that? Padding constructive criticism with positive feedback. Yeah, so this is a common MMI scenario. To those of you who don't know, where you're asked comment on an interviewer's, like a fellow interviewee's performance, right? So again, a lot of the evaluation on a situation like that really just has to do with even just basic people skills, right? So my suggestion for stuff like that is, be able to sort of humanize the situation, recognize that this is a stressful moment for both you and the other interviewee. So, being on the other side, you'll often see people do stuff like, forget to even introduce themselves to each other and just basic things like that, right? So make sure you sort of get the basics before going into the substance of the of the conversation. There are many ways to kind of do this. If you're providing feedback, it depends on the question. Some questions will sort of ask you more generally to provide feedback, to provide response. Some questions will actually ask you to sort of say how could that person do better, right? A lot of this has to do with your choice of wording. Really, this is the time to sort of talk. Talk like a politician. If you are sort of using, if there is a negative thing that you're delivering, I think if you're phrasing it as this is how you could have been done better, as opposed to this is you sucked, that looks much better. And I think a lot of the way I go around that is often to sort of say I think the intent was good, right? So you can sort of say to somebody that I see what you were trying to do in that situation, but to me it came across as this. But I think had you sort of done this a bit differently, it would have conveyed your original intent, right? So that sort of automatically disarms the person opposite you, because you affirm that, oh, okay, you recognize that person's intent was to do something nicely. So that that can be quite a good tool to speak to common intent, and then criticize the tactics in terms of the choice of words or the example that was used, and say that was not the best choice because it didn't speak to your broader intent. So if you break down the sort of different levels of your answer and say you agreed with sort of maybe the overall picture, or that they're a nice person, but that wasn't the best choice of example, I think that can help. The other approach that often gets brought up is something called the sandwich approach. I mean, a lot of people have debunked that, but you don't have to be super formulaic in your answers. You don't have to sort of do good, bad, good. But again, the overall message is you can't sort of completely flatter the person by sort of saying everything good. You can't sort of completely dehumanize someone by saying everything bad. So finding that balance is the tricky part, and that you get better at that with more practice. All right, so hopefully that answers your question, Rishi. So we have a couple more questions. So just a shout out to anyone who's out there. If there are any additional questions, just get them in. We're getting to sort of the last 5 or so minutes of the Q&A. So you definitely want to get the questions in, because I'd much rather take the live questions than do the pre-prepared questions. All right. So one of the questions that I think we were emailed was, is it effective to practice my interviews with a friend or a family member? The answer to that is absolutely, right? I think the more practice you can get, the better. I remember trying to ask, trying to get my hands on anybody to see if they would practice. I found practice with myself to sort of be the first step. So I would record myself, and then. So I think, Amal, you're having some technical difficulties, looks like, with the video loading every 3 seconds. So I'm not sure if anyone else out there is having those challenges, but if someone else is, please comment. And those are issues that we'll try and fix the next time around we do this. So just going back to my point about preparation. So I did a lot of recording myself and seeing how I would come across, and I think that for me was quite effective because I was quite critical of myself. I noticed a lot of a lot of likes and things like that I noticed that I had to cut out when I was doing an actual interview. So I started with that. Friends and family members, I did a bit of that, but there were lots of free resources out there in terms of career centers, other med students, and I did use a couple of paid resources. I think I used there were med students working for one of the prep companies out there, and I used them for preparation back when preparing for my own interview. So use a variety of approaches. They all sort of have a role to play. The more prepared you can be before you sort of get to sort of med students and residents, the more you're going to get out of a session like that, because you really don't want to use them if you haven't even done your own background research. All right, so let's take maybe 2 more questions. What is one thing you wish you could have done differently while you were preparing for interviews? I think one thing I probably would have done a bit more differently would have been to get to practicing a bit sooner. I think I spent a lot of time sort of researching way too many questions, because there's no end to the number of questions and scenarios that are out there. I think if you sort of just get a quick sense of what the basic question types are, what are a couple of examples of each types of questions, and you start sort of crafting sort of your own answers, the sooner you can get to practicing, the better, because this ends up being a cycle. Every time you practice, you're going to learn things that you could have done better. So you have to sort of find that point where you're going to take that leap of faith and actually start doing practice questions. So one thing I probably would have done a bit differently is to get to practicing a bit sooner. All right. So let's take one more question. Again, if anyone is having any, if anyone's having any live questions, please type those in. So I think, Rishi, you're having the same technical difficulty. So that is something that we certainly will look into the next time around we do this. So let's take one more question. So I think this is a good one. So when should I start preparing for interviews, and how should I prepare not knowing if I will receive an invite? Which interview format should I start preparing for first? So this is challenging because oftentimes if you're doing interviews and you're in 4th year of medical school, 4th year of undergrad or 3rd year of undergrad, or in grad school, and you have a full schedule on your plate, interview preparation itself is a lot of work. So while the ideal answer is it's never too soon to start preparing, I think what you have to do is sort of get a sense of realistically when the interview dates are for the schools that you've applied, and start to prepare a couple of months before. So for Canadian schools that have interviews in Feb, March, early April, now's a great time to start. And I think this is when sort of most people would have started by sort of February to start doing their research. It is always tricky when you're not sure if you're going to get invited, but I think the way to look at it is that if your goal is to sort of become a physician, you're going to have to do the interview at some point, even if you don't get in this year. So you really don't want to be in a spot where you're waitlisted and you sort of suddenly get an interview because somebody can't make it, because that certainly has happened to even friends of mine, where they get an interview with about a week's worth of notice. So that sort of really can put you in a position where you're left scrambling. So I think the earlier you can start doing research and preparing, the better off you'll be in the event that you'll do an interview. So that'd be my 2 cents on that. In terms of which interview format you should start preparing for first, again, I don't think you want to get too hung up on the format. I think tailoring to the format ends up being something that you do later on. You always start with sort of doing stuff yourself, all the research, practicing yourself, maybe recording, and then going into specific formats, right? I started a lot with a lot with traditional interviews because I think those sort of tended to those were the majority of the interviews that I was going to face at the point that I had applied. But this depends on the schools that you think you have a more realistic chance of getting in. If the only schools that you've applied to have MMIs, go straight for the MMI, right, or MPI or whatever format variation. So tailor it to what's going to be your experience on the real day. All right, so it's 6:45. So hopefully that was helpful. If there are any additional questions, feel free to type them in the comment section. We will get to them the next time around we do this. Our goal at MD Consultants is to do this every 1 or 2 weeks during interview season, so we can get as many questions as possible. There'll be someone else doing this next time around, so we will get through the remaining questions. Keep your comments coming in terms of technical difficulties or anything else of that sort as well, because those are things that we certainly will troubleshoot. Our intent is also to put all these videos together so they'll form a repository that people who were not able to make the live chat today can access. All right. Well, thank you so much for signing in. Take care. Have a good rest of the evening.